Welcome to Women Mastering Midlife, where we dive deep into the rich complexities of womanhood in our middle years. I'm your host, Victoria Bird, a pharmacist, certified women's health coach, and your guide on this transformative journey. Whether you're navigating perimenopause, thriving in menopause, or mastering midlife's many transitions, this is your weekly dose of expert guidance, compassionate support, and a judgment-free space to explore it all. Here, we're empowering women to master midlife on their terms, reclaiming our health, our happiness, and our power. Together, we'll rewrite the narrative around this remarkable stage of life, from something to dread into a beautiful, bold transition. I'm so glad you're here. Today on Women Mastering Midlife, I'm thrilled to welcome Julie Parana, better known as the Menopause OT. Julie is an occupational therapist and menopause educator who helps women navigate the profound physical, emotional, and lifestyle shifts that come with menopause, particularly, we're going to talk about today, surgical menopause. Through her work, Julie empowers women to reclaim their well-being, rebuild routines, and find strategies to thrive during this often unexpected transition. Her compassionate, practical approach bridges medical insight with everyday life, making her an invaluable voice for women who are navigating menopause earlier or more abruptly than expected. Hi, Julie. Thank you for coming on.
Thank you so much for having me. Happy to be here.
We were talking a little bit earlier, and this isn't a topic I've discussed before, and I still have all of my parts intact. I have a uterus, I have ovaries, so this hasn't been something I've experienced, but I do know that there are a lot of women out there who, they're having rough periods, and they're like, I just want to take it all out. And I think there's things that there should be an education piece ahead of time and an awareness of what can happen and how to manage it when you have to have one, and why you might not really want to elect to have one if you have the option to sustain from doing that. So can you share a little bit about your story and what led you to focus your OT practice on menopause support? Oh my gosh, I'm going to say that over again because I have too many S's. I needed to drink something, and I drank all of my Diet Coke, and then I don't feel like I should be drinking Diet Coke on camera because it's like going to kill me.
I get dry mouth very easily, so I do have water here just in case.
Okay. Can you share your story with us today and what led you to focus your OT practice on menopause support specifically?
Sure. So I am 45 years old now, but when I was 42, I had a hysterectomy. I had a condition called adenomyosis, which is sort of like endometriosis's evil stepsister. It's when your uterine lining grows into the muscle wall of the uterus where it's not supposed to be. And that was causing me a lot of uncomfortable symptoms. I had horrible pelvic pain, all the time cramps. Even if I wasn't bleeding, I still felt like I had my period. I was having a lot of bloating. The bleeding was very heavy, and also sometimes I was bleeding up to 35 days consecutively. So It was really just destroying the quality of my life. So I had a hysterectomy, but my ovaries were left intact. So I was told by my surgeon that my hormones would not be affected at all, that I would go into menopause at the normal time. And that made sense to me since my ovaries were still in there. So I did recover very quickly and easily from the surgery. I felt great, but then not too long after surgery, I started to experience a lot of symptoms, but I didn't recognize those symptoms as being part of the menopause transition because I didn't know what happened in menopause. Other than hot flashes and night sweats, and those were not my initial symptoms. So my initial symptoms were really bad brain fog, horrible word finding problems, memory lapses, trouble paying attention. I really felt like I had early dementia, which does run in my family. So I started to freak myself out that I had that. And then I was getting lots of new allergies and rashes. I was just constantly breaking out into hives. I had a horrible bout of plantar fasciitis that lasted months and months and months. And, I'm a therapist, so I know all the things you're supposed to do to treat the plantar fasciitis, and none of them were working. And my cholesterol was creeping up. I was gaining some weight. I was having trouble sleeping. I was getting dizzy, like bouts of vertigo were coming and going. And so I was kind of running like specialist to specialist, trying to figure out what the heck is wrong with me. And then finally I had some hot flashes and then it clicked. Oh, this is hormonal. I had blood work done and my estrogen was 15 and my FSH was really high.
Yeah.
So no wonder I felt so weird.
Yeah.
And I just got a message in my patient portal from my doctor that said, you are postmenopausal, that explains your symptoms. But that was it. No education, no discussion on, I was 42, so I went through this transition about a decade earlier than I should have. And no education was offered to me, no mention even of menopause hormone therapy or hormone replacement therapy. So, I read everything I could about menopause. I really just started researching it to figure out what I could do to feel better. Learned about hormone therapy, learned that a lot of what I thought I knew about it was incorrect. And so I found another doctor to help me prescribe hormone therapy to me. And then I started implementing other lifestyle changes and I felt like myself again. I felt great again. And I just wanted, as an occupational therapist, this is what I do. I help people navigate their health conditions. That's what I've done my whole career. And so I just sort of had this light bulb moment that the same way I help my patients who've had an amputation recover from that and, help them manage their diabetes, I could do this with menopause. So I got certified in women's health and in menopause coaching. And now I help other women through this stage of life.
Yeah, I think our paths are very similar. I mean, I obviously pharmacist versus occupational therapist, but it happened to me. And it's so frustrating that it takes having a hot flash for you to actually figure out that it's menopausal symptoms. Because I started with just the simple, like I couldn't remember a date. And I was the one I know my credit card number from college. Like I know those things. I'm on top of the birthdays. I don't miss the anniversaries. I'm the one that makes sure we have the card in the mail for people. And I couldn't remember anything. And I couldn't remember words. And I remember being in the car driving north to Seattle for something on a weekend. And I just said, I think I need to be tested for early onset Alzheimer's because I was completely losing it. And no one ever said anything about the brain symptoms of menopause to me. And then I started having night sweats and I was like, well, then maybe there is something to be said. But it's unfortunate that we have to go through all of this misery to finally get to a symptom that can be related to menopause.
Right. And it's just because the education is so terrible. No one taught us any of this. And unfortunately, once I started learning all about it, I learned that most doctors get no training in menopause. And even OBGYNs, only 20% of them get any formal menopause training. And a lot of what they get is like, just an hour or two. It's not sufficient. And so, it's just such a huge gap in knowledge. And so yeah. And like yourself as a healthcare professional, I just felt like, okay, I need to fill this gap then. I need to do something about this and try to educate women and help them through it because really you don't have to suffer through menopause and women are just needlessly suffering when there are things that you can do to feel better.
Yeah. And there are a lot of lifestyle things that can be done. I mean, clearly when your ovaries are not producing hormones, you can't get them to start back up again. It's not a lawnmower engine that you can,
Yes.
take to the mechanic and all of a sudden it works again. But you can do some things to manage with lifestyle in addition to hormones if you want to put those on board. Some women don't. But so we talked a little bit about we talked a little bit about surgical menopause and how you kept your ovaries. But can we talk a little bit about the reasons why women, other than what you were diagnosed with, can undergo the surgery of a hysterectomy for?
Sure. So true surgical menopause is when your ovaries are removed. So my story is a little bit different because my ovaries were in there. They just didn't get the memo. They could keep functioning. I think blood flow was impacted by the surgery. So that's why they stopped functioning even though they were still in there. But for women who have their ovaries removed, that can be done for endometriosis, fibroids, ovarian cysts. And then some women opt to have them removed for risk reduction surgery. So if they have a genetic mutation like the BRCA gene, and they want to reduce their risk of cancer, they will have their ovaries removed.
Okay, so surgical menopause is when you remove both the uterus and the ovaries, and you are no longer producing estrogen from your ovaries since you don't have them. But in your case, it was surgical menopause because your ovaries stopped working due to your surgery.
Yes.
Okay.
And then some women can enter it because they have cancer treatment. So that can also cause their ovaries to stop functioning as well. So the ovaries might be in there, but because of the cancer treatment that they're undergoing, they could stop functioning as well.
So for a lot of women who are experiencing the menopause transition is typically anywhere up to 10 years. And it can be kind of a gradual, it might feel, I mean, like for me, it felt like a shock to my system, but it is a gradual process. But with surgical menopause, what is the difference as far as the symptom presentation?
Yes, exactly right. So, usually you're going into this gradually, not that there aren't a whole host of symptoms when you go through it that way either, but it's sort of like a dimmer switch, right? Like your hormones are sort of gradually going away. But with surgical menopause, that switch is it's a light switch. They are flipped off. So you go from making them to not making them at all. And so often the symptoms will just be a lot more severe. You'll feel like you were just hit by a truck because your body just kind of goes into a state of shock where, our hormones are, they do so much more for us than just regulate our menstrual cycles, which I think is also something a lot of women don't realize. So, it doesn't just make your period come and go. Our hormones are very critical messengers that work throughout our entire bodies. And so when we lose those, we can have many, many symptoms. And if you lose them overnight, immediately, those symptoms can definitely be much more pronounced and amplified.
And estrogen is a really good anti-inflammatory hormone in the body. And so you start to see all of the things with your bones and your muscles and your inflammation and your gut health and in your digestive system. There's so many things that it affects. So what are some of the long-term health effects of having surgical menopause?
Right. So, women who go through this transition early, if you undergo surgical menopause and you do that before like age 45, which is considered 45 to 55 is considered normal menopausal age. So, some women are undergoing surgical menopause in their 30s or even younger. And so without those critical hormones, you really set yourself up for a whole host of increased risk of osteoporosis. Our bone density declines rapidly without estrogen, increased risk of heart disease. Estrogen is very important for our cardiovascular health. It protects our blood vessels. So our cholesterol can creep up, our blood pressure can creep up and increase our risk for heart attack or stroke. As you mentioned, it's so protective of our brain health too. And so women who have early surgical menopause are at increased risk of dementia because of that as well. And then all the issues with our metabolism, it increases our risk of insulin resistance and diabetes and weight gain. And, it has impacts on our sexual and urogenital health too, with vaginal dryness, painful intercourse, urinary symptoms. All of that can result from surgical menopause.
It's like, sorry to terrify everyone out there who hasn't experienced any of these symptoms yet, but there's a litany of fun coming your way.
There is a litany of fun, but there are things you can do to treat it. And, this is why it's so important. Unfortunately, there are still so many women who are going through early surgical menopause who are not properly counseled that this is what's going to happen to them. And it's, it just does such a disservice because there are things you can do to fix this. Again, a lot with lifestyle, but also hormone replacement is really considered the gold standard treatment if someone is going to go into early menopause, unless there is a contraindication. If a woman has a hormone sensitive cancer, then she's not going to be a candidate for hormone replacement at that time anyway. But most women are candidates. A lot of women who are undergoing these surgeries that are putting them into surgical menopause are still candidates for hormone therapy, but they are not properly counseled. They should be waking up with an estrogen patch on their body, but that's not what's happening.
Right.
More than half of women are not waking up with an estrogen patch on their body, and that needs to change.
Absolutely. And I think that it's one of the things that should be an easy education piece for OB-GYNs that are performing these surgeries, these hysterectomies. And I think that, maybe it's just my algorithm. I'm sure with my algorithm, I see
same thing all the time. Like, how do people not know this yet? But again, our feeds are showing us what we're interested in. So
I think so.
Yeah.
All I'm reading, and it's funny because I just finished I was doing a few episodes for a series on sexual wellness. And so you can imagine what my algorithm has been leaning me toward now. I mean, if I have one more device ad on my Instagram feed. So it's between that and hormone replacement therapy and symptoms of menopause and the occasional recipe for meal prepping. But other than that, like that's my social media. But you would think at this point, I mean, doctors are going to the Hill. They're trying to make changes with the FDA with black box warnings, specifically on vaginal estrogen, but also it should be really it should be changed on all estrogen products. And then you go into the whole testosterone. Don't get me started on that being
that's a whole other show.
I'll get on my soapbox about prescription medications and hormone therapy. But I think that, we need to start changing the conversation around this for patients who are going into this surgery. I think that, it's one thing to not have it be on the 15-minute annual screening of a standard patient at an OB-GYN's office, but to be going into a procedure where you are removing organs that produce the hormones. This should be part of the conversation.
100%. And it really blows my mind that it's not. And I personally think that a lot of it is just gender bias in medicine, because I don't think there's any world in which we would castrate a male and not replace his hormones. That would simply never happen. And removing a woman's ovaries is castration. And
I was thinking about testicles shriveling up and what men would do about it. And it would be like, there would be so many, it would be a formulary drug, it would be cheap, it'd be easily accessible, and everyone would get it. Yep.
Yes. Yeah. But for some reason, it's just thought like, oh, well, these are just for reproduction and she wasn't going to have any more babies anyway. Or, it's just, it's wild. But I think the tide is turning. Like you said, there is more discussion of it, but we have a long way to go. And I still hear from women every day who are getting dismissed by their doctors, who are still getting blatant misinformation from people with medical degrees telling them that hormone therapy isn't safe, that it's going to cause them cancer, or that they can't take it because they have a history of cancer in their family. And none of that is true. And it's very upsetting. So, that's why I'm out here. That's why I know you're out here trying to educate women, and again, not everyone's going to choose to replace their hormones, and that's perfectly okay. But I just want women to make that decision based on the relevant facts and,
proper research,
the true information. Not on misinformation and fear, which is unfortunately where a lot of people still are. So,
well, and in the case of surgical menopause, you're dealing, so for women who hear it's part of getting older, the going through menopause, and these women are younger than that. And so you're telling me at 35 that it's part of getting older and I'm just supposed to deal with it, when it's never okay for a 50-year-old woman or a 60-year-old woman to hear that. But to have a woman be that young and just have to think that this is the rest of her life, there has to be some mental health implications. Are you seeing that with women with surgical menopause?
Huge mental health implications, yes. So, our hormones act in our brain. They really affect our brain chemistry and our neurotransmitters. So our serotonin, our dopamine, our GABA, all of that relies on our estrogen, progesterone, and our testosterone. And so when you don't make those hormones anymore, how could it not have massive impacts on your mental health? And many women are just handed antidepressants and anti-anxiety medications. And while sometimes those are very necessary and needed, often what would really help is address the root cause of the problem, which is replace the hormones in the first place, because that's what's leading and driving all of the symptoms.
If you're navigating the maze of perimenopause and wondering, is this normal? You're not alone. My free guide, Menopause Science and Symptoms, breaks down what's happening in your body and why. It's your roadmap to understanding the changes and embracing this phase with confidence. Download it now at missvictoriabird.com/free guides and take the first step toward empowered wellness. You'll also find the link in our show notes below. Be sure to sign up and grab that free guide. So as an occupational therapist, how do you work with the menopausal patients?
So a lot of it is education, just going over what we're discussing today, because most women don't know this. But then I really work with women on implementing the lifestyle changes. So, I can't prescribe hormone therapy. So what I do is help women work on nervous system regulation, on stress management, on sleep hygiene practices, educate them on nutrition. And, we work on making sure we're getting enough protein and enough fiber and anti-inflammatory diets. And then all of my clients are working on strength training. So we're making sure we're building our bone density, we're building our muscle. So new strength training programs every 4 weeks. So we're working on progressive overload, because all of that becomes, a big issue when you're in menopause, whether you go through it early or not, or surgically or not. All menopausal women need to focus on these things. And so, so that's what I'm helping women with.
So we talked about hormone replacement therapy and how it is important. And I think, and it should be given as an option, a well-educated, researched, explained option for women. What should women know before going into the surgery about, oh gosh, I just completely lost my thought. Okay, here we go. This is the third one I've done today.
Oh, wow.
I know. I don't know how it ended up like boxing a whole bunch together in one day. And I'm like, oh my gosh, what question am I?
Yeah, I can imagine your brain's fried.
A little bit. And it's Friday. And I was up at 2 a.m. because, even though I have hormone therapy, it doesn't fix everything all the time.
Nope.
So, yeah. Okay. What should women know before undergoing surgery that could put them into surgical menopause?
I think they should know what their plan is. Have a discussion with the surgeon that's doing this surgery. What is my plan for after this? This is going to put me into immediate menopause. What are we going to do about that? And in most cases, that answer should be replace your hormones. If you're not a candidate for that, or if you just choose not to do that, then you want to know what your non-hormonal treatment options are going to be, because there are non-hormonal treatment options. And also just know what the symptoms are so that when you start to have them, you don't freak yourself out that there's a million other things wrong with you and run to specialist like I did, wasting a lot of copays and a lot of time when all of those symptoms were related to menopause. And just, be prepared so that when these things start happening, you know why they're happening, and then you can address it. And I think if your ovaries are coming out, no one should ever take a wait and see approach to this, which is, I think, sometimes what women are told by their doctors, like, oh, we'll see if you have menopausal symptoms. But even for those few lucky women who sort of breeze through menopause without major symptoms that they're feeling on the, like the sleep issues and the mood issues and all of that, it doesn't mean menopause isn't doing things like destroying their bone density or, causing issues with their metabolic health and their cardiovascular health. Those are silent things that you may not know is happening. And so, you really need to be aware of all of that so that you can make an informed decision about how you want to treat it.
Yeah, I think one of the things that I've recognized through time is that a lot of women, or a lot of people in our healthcare system, I feel like I don't know if we've been like sold this bill of goods that we just believe our healthcare providers. And when we go in, we tell them what's wrong. They'll have an answer. They'll give us a solution. It'll be fixed. And then we can move on. And there's really a need for advocacy, and you have to be your own self-advocate. I know I try to work with women on a regular basis about being their own advocate. A lot of times it's just learning to speak up and being prepared. What are some of the things that you work with women so that they can be a prepared advocate for themselves?
Yeah, well, to this example is just maybe your surgeon isn't the person who's going to help you through this, then you ask for a referral for a menopause specialist. This surgery is going to put you into menopause. And even if you have a great surgeon who is going to give you an estrogen patch when you wake up from surgery, hormone therapy is not one size fits all prescription. It's not like a one and done, you're great as soon as you use that. Often you need to adjust your dose, you need to adjust your delivery method. You might start with estrogen, but then later want to add progesterone or testosterone. So you really need to have someone you can go to who can follow up with you for that. And that's probably not going to be your surgeon. So I would ask them for a referral for a menopause specialist so you know where you're going, what your next steps are going to be, and that someone's going to be following you long term for that.
Yeah, I remember. Oh, go ahead.
Have your questions written down. Doctor's appointments are going to go fast and you're going to be flustered and you might forget. So bring questions in writing with you. Get a second opinion if you don't like the answers you're getting. It's okay. It's your health. And A lot of times women are, especially with the OBGYNs, they liked the doctor that delivered their babies and they sort of feel like they can't go against that doctor or break up with that doctor, but that doctor might just not be a good menopause informed provider. And that doesn't mean they're necessarily a bad doctor, but they may not be the best doctor to take care of you in your menopausal years. And it's okay to seek another opinion.
Yeah, I think maybe it's like an oxytocin bond when your baby comes out, you're like immediately attached to your OB-GYN. I don't know. I think, understanding the way medicine works and the way medicine residencies and fellowship trainings work, OB-GYN is still even it's a big umbrella. And I wonder if at some point we should separate it out a little bit more. We have doctors that work with neonatologists, and we have maternal fetal medicine. I had an MFM specialist because I was a high risk pregnancy. And so I had to go to my OB-GYN and a specialist. I don't see why we can't just we need more, I guess, is the issue. There aren't enough menopause specialists, really. I just answered my own question. But it's, we need to get more of the people that are reading the research and doing the work and talking to women in this stage of life to be the people that care for these patients. I don't know about you. It took me a year and a half, 2 years to dial in how I was going to approach hormones.
I'm still making adjustments just to complicate things even more. I have Ehlers-Danlos. And one of the things that can affect is how you metabolize medications. So my entire life, I have needed higher doses of medicine. Medicine always feels like it doesn't work for me. And so I actually have to wear 2 estrogen patches now. And it took me a while to figure that out. And I have a provider who listened to me, and we checked my blood levels. And, since I am postmenopausal, it's easier to go by my blood levels. It's hard if you're in perimenopause and you're still fluctuating a lot. But we know my ovaries aren't making anything. So whatever my estrogen is, it's what I'm getting through the patch. And I wasn't absorbing very well at all with the highest dose patch. And while my symptoms were relatively well controlled, I was worried about my bone health and my heart health and all of that. And so, especially having gone through this early. So yeah, I just recently increased my dose again to make sure, that because my levels were still only 40 on the highest dose patch. And I guess a lot of the research now is saying 65 or a little higher for bone protection. So I really wanted to make sure that I was doing that.
Yeah, it is a lot easier to manage hormone levels in menopause versus perimenopause because this is a wild ride. And I will say in the beginning, early stages of perimenopause, actually having estrogen on board was not doing me a service. I mean, I was having all of the breast tenderness and the weight gain and all the bad effects of having too high of estrogen.
Yes.
And then when we upped my progesterone and we cut back the estrogen, I was like, oh, here I am. It's me again. But it is amazing the difference that it can make for women. And so to think that women would go through surgery that removes organs that produce hormones and just be left off to their own devices, you're already recovering from a surgery. And to some women, having this surgery is mentally, it's something they have to grapple with if they weren't ready to lose these organs and their reproductive abilities. And then you don't tell them that they're going to be experiencing menopause symptoms, and they may not even be hot flashes.
Right. And so then they have all these host of symptoms and they don't recognize why, and they just wonder why they don't feel like themselves at all.
Yeah. So when you're working with women, how long do you typically tell them to try things? I mean, it can't be in a week you're feeling better. You might feel a little bit better, but you're not going to be settled into something. So how long would you tell women who've had surgical menopause to give their regimen and their treatments before they would start to make adjustments?
Yeah, I think it really depends. You definitely are not going to see results overnight. So probably 4 to 6 weeks at least to see if you're going to have some improvement. Also, sometimes you don't know how much better you could feel until you increase your dose. So that was the case for me, because even when I was on the highest dose patch, I felt pretty good. And so, but I was concerned that I wasn't absorbing enough. So we checked my levels and I was right, I wasn't. And then when I increased it, I'm sleeping so much better. I have a lot of with the Ehlers-Danlos and musculoskeletal syndrome of menopause, I do have, some joint pain. I have herniated discs in my neck and stuff. And I just thought a lot of that pain that I was having was just that to be expected pain, but that's gotten a lot better since I increased my dose. So it takes playing around with it, give it some time. If your symptoms aren't improving, increase. You'll know you're at the right dose when most of your symptoms are improved, but you don't have negative side effects. So I've increased my dose, but I don't have any negative side effects. I'm not, having any breast tenderness or headaches or anything like that. Yes, I think a lot of women give up a little too soon on the hormone therapy because either they don't see great results right away or they do have some side effects that often will go away after a little while. I do get headaches when I increase my dose, but only for like a week or two and then it stops. So your body needs time to adjust. That's why it's just important to work with a prescriber who is going to talk you through all of this and not just, give you a patch and send you on your way, because it is a trial and error process. It does take a little while. And, it doesn't work for everybody. I think it works for most women if you have patience with it and you trial different things out. But there are some women who just don't do well on hormone therapy, unfortunately. And then they need to really hone in on the lifestyle stuff. Whether you replace your hormones or not, you really need to be working on the lifestyle stuff too. The hormones aren't even going to work that well if you're not a healthy host for them to do their job. But
that was exactly the next thing I was going to say, is that even when you optimize your hormone levels, if your diet's trash, if your sleep is poor, if your stress levels are through the roof, if you're not moving your body, you're not doing yourself a service.
Right. Yeah. And sometimes people don't want to hear that. Making lifestyle changes is hard. That's what coaches are for, to help you gradually implement them so they don't feel overwhelming, and so that you can, make small changes that eventually over time add up to, helping you feel your best.
Yes, absolutely. And that's why it's really good when you work with someone who understands the clinical side of it as well, because then you have someone holding you accountable, helping you along the way, but also recognizing, okay, this is probably something that needs to be addressed outside of my scope.
Right.
It's time to talk to your doctor again.
Yes. Yes.
Yes. So what message do you want women to know who are facing surgical menopause? Like, what do you want them to take away from our conversation today?
Well, hopefully we didn't scare you too much because at the end of the day, I always say that my hysterectomy was 100% worth early menopause. And I feel great now. My body has no idea it's in menopause with the hormone replacement, with the lifestyle changes I have made, with prioritizing my sleep and managing my stress, doing things that I had never worried about doing before I went through this transition. I feel great. So menopause doesn't have to suck, but you just have to be prepared for it. Have a plan in place, know the symptoms, know how you're going to treat them, advocate for yourself, and you will get through it.
Yeah. Well, and I think that there's a lot of women who, once you're getting to the point of surgical menopause, you're not feeling great. For the people who aren't doing it for for prevention of cancers or other diseases, then you weren't feeling good. And so the scary litany of symptoms we just listed off, they're treatable and you're going to feel better.
Yes. Yeah. I mean, my quality of life was not great before this. And granted, there was a period of time afterwards when I didn't know what the heck was going on, where I didn't feel great either. But now that I have it all figured out, I feel great. And I want women to know that there are solutions, there are things you can do. You don't have to suffer through it. And if you get an answer you don't like from a doctor, find somebody else. Your doctor's not informed.
Yeah. There's a reason why we've gone through this, so that we can then lessen the burden for those behind us.
Exactly. Yeah. This is why I never shut up about menopause. I just want women to know too many women are suffering needlessly. And so, yeah, voices like us speaking out, hopefully, we'll find as many of them as we can.
Yeah, absolutely. I know my 14-year-old, every time we go somewhere and somebody stops me, they're like, Ma, more menopause talk. Seriously.
It's like my whole personality at this point, but that's okay.
Right? I know. It's like I'm 45 years old. It's so sexy. Let's talk about vaginal dryness.
Oh, yes. Oh, I'm glad you just said something about vaginal dryness, because we talked about all this hormones and systemic hormone therapy, but absolutely every woman is a candidate. Pretty much every woman is a candidate for vaginal hormones. And so if you have had surgical menopause, But you aren't a candidate for systemic hormone therapy. If you do have cancer that is hormone receptive positive, that does not mean you cannot use vaginal estrogen. And that message is still not getting out, even though there are clinical practice guidelines from the AUA that clearly state this now. There are still a lot of physicians that do not know this and are denying women vaginal hormones. And that's just unacceptable, because that should be standard care given to every menopausal woman, whether you have cancer history or not. So definitely, at the very least, be using vaginal hormones.
Yes, I wholeheartedly agree with that statement. And I think that, there are a lot of women out there who are afraid of it because it's misinformation. And then also this idea, so you remove my uterus, that doesn't mean my vagina doesn't still, like my vulva doesn't need estrogen. So newsflash, I think that should be another thing. They give you your estrogen patch and a tube of vaginal estrogen on your way out of the hospital.
Absolutely. Agreed.
Yes. Yeah. On that note, so after we vaginal dryness, now I'm shadow banned. Every time I talk about a vulva or vagina, you hit shadow ban status. So
yes,
fabulous.
It does happen. There was the whole Say Vagina month for October or August, I think, right?
Yeah.
Yeah, content does get suppressed. Although I had a vaginal estrogen post yesterday that jumped up to 10K views pretty quickly. So I was like, okay, maybe it's not always shadow banned, but they're hit or miss. But yeah,
it's about time. We're a big demographic on social media.
Right.
We want this stuff.
Exactly. And it's not a dirty word. It is anatomy, for crying out loud.
I know. So for people who are interested in finding more about your work, or if they want to learn how to work with you, where would they find you?
Well, you can find me on my website, themenopauseot.com. I'm also the Menopause OT on TikTok and YouTube, and the Meno OT on Instagram.
Awesome. Thank you so much. Thank you for coming on and talking about this. I know there are women who have thought about having hysterectomies, or they have had them and they don't know what's going on. So I appreciate you coming on and sharing your knowledge on this topic. And I hope that it maybe it scared you a little bit into becoming more informed and being an advocate for yourself, but also understanding that there is a light at the end of the tunnel on the other side of it.
Absolutely. Yes. Knowledge is power. We're not doing this to scare you. We just want you to be able to make the right decisions for yourself. So thank you so much for having me.
You're welcome. Thank you for coming.
Thank you for listening to this episode of Women Mastering Midlife. If something you heard today resonated, I'd be so grateful if you'd share it with a friend who might need a little extra support on her midlife journey. Remember, small changes can make a big difference, and you don't have to navigate this transition alone. We will be back next week with more expert guidance and compassionate conversations to help empower you to master midlife on your terms. Until then, you can find us on Instagram at Women Mastering Midlife, or come connect with me directly at Miss Victoria Bird. And you're looking for deeper connection and support, be sure to join us in the Women Mastering Midlife community. We'd love to continue the conversation with you there. If you've enjoyed this episode, please rate and review this podcast. It helps us reach more amazing women mastering midlife just like you. You'll find all the links from today's episode and ways to connect in the show notes below. See you next time.